Hi, I'm Dr. Dung Trinh, an internal medicine physician practicing in Southern California. Today, I'm going to talk to you about what Alzheimer's disease is, what are the early signs and symptoms of Alzheimer's disease, and what to do after diagnosis. So, Alzheimer's is a progressive disease. What that means is that the signs and symptoms get worse over time. It's considered an irreversible, a one way condition that occurs over time. Alzheimer's disease fall under a bigger umbrella. That bigger umbrella is called dementia. And dementia is a umbrella that includes any type of problems with memory, with thinking, where we have death of brain cells. So we're losing brain cells over time. So under this big umbrella of dementia, Alzheimer's take up 2/3 of the umbrella. Everyone's heard of the plaques and tangles is the terminology we use. The plaques of Alzheimer's are these beta amyloid proteins that build up to become a plaque. They live outside of the brain cell. And what they do is they interfere with the brain cell's ability to communicate and connect and talk. The tangles are what we call tau tangles. And these are proteins that live inside of the brain cells. In Alzheimer's disease, what happens is that the tau proteins gets tangled up. When they get tangled up, inside of the cell, they cause the brain cells to die. And what happens a few years before your first memory loss is you start to lose brain cells. Brain cells are dying. How do we know that? We know that because the size of the brain actually shrinks. And we can see that on yearly MRI scans. What happens is before the first memory loss, plaques have been building up for 20 years, tau tangles have been building up, and the brain already has started to shrink in its size. That's due to the loss of brain cells, the death of brain cells associated with plaques and tangles.